Good afternoon. I'm Jim Inkster, your moderator for the 55th program from Governor John Bel Edwards. He dutifully does this with the people of Louisiana every month and has not missed a month since April of 2016 when we started. He's here for the full hour if you'd like to talk. 877-217-5757 is your Ask the Governor number. And as we know, much is happening in our world. We are 13 days away from an election. There's a special session going on in the House. And we're in the midst of a pandemic with waves across the country happening for the second, in some cases, third times. And Governor, let's start there. You have been holding these frequent press conferences, updating the people of Louisiana. But right now, 7 months and 5 days into the first stay-at-home order, where does Louisiana stand?
Well, first of all, thank you for the opportunity to do this again for the 55th time. And you forgot to mention we're recovering from 2 hurricanes on top of all the other things that
is true.
That you said. So I can give you today's numbers real quick. 744 more cases today on 14,302 tests. We're at 5,584 deaths total. That includes 12 that we announced today. Sadly, about the deaths, but also the hospitalizations, we're up to 608 today. Just a few days ago, we were in the mid 500s. So that's the statistic that's most concerning to me right now. But overall, Jim, we're doing relatively well. It appears to be fairly certain that most of the country is in the third surge or the second wave, whatever you would want to say. And I'm not going to say that that's happening here yet, although I can tell you we've had a very slight increase over the last week in percent positivity of our tests. I just told you our hospitalizations are up. But overall, we're one of 15 states in the country that's in the orange zone on new cases per capita. All the rest are in the red zone, meaning they have more than 100 new cases per 100,000 over the previous 7 days. We're 36th for new cases per capita over a 7-day period. We're in the green zone for positivity, meaning that we're less than 5%, although that was last week. We're slightly above 5% right now based on the last couple of days. So our mitigation efforts are working. And obviously we need to continue those because that's how you keep the biggest part of your economy open as much as possible. You open your schools and your universities and have as much normalcy as possible. And you can do it without transmitting the disease, but you can only do that if you wear your mask or your face coverings, you wash your hands frequently, you stay home when you're sick, and we social distance from people who are not part of our immediate household, and if we'll do those things, we're going to be fine. I'm really concerned, like the rest of the country. We're heading into flu season. We don't want a big flu season while we also have COVID, because they both put demands on the same part of your healthcare delivery system. So I do want to encourage everyone to get a flu shot this year. Even if you don't normally get them, please get a flu shot this year. And then the same mitigation measures I just discussed also reduce the transmission of the flu. And so it's doubly important that we do that. But I appreciate the question. It's always tough. And, we get weekly reports from the White House who are looking at state-specific data, and they make recommendations. And the decisions that we have made have been consistent with those recommendations from the very beginning. But look, it's always a tough situation. There's nothing easy about these decisions. I know that there's just COVID fatigue happening around the country and here in Louisiana. But just because we're tired of the virus doesn't mean the virus is tired and going to leave us alone. In fact, that's not going to happen. And so we just need to be resolute and determined, and we're going to beat this thing. But it's just not over yet.
Now, there was some discussion a few days ago about the Saints playing games in Tiger Stadium. I think a compromise has been reached, but the Superdome is an indoor arena. Your thoughts about putting people in the dome to allow fans to watch their beloved New Orleans Saints?
Well, generally speaking, any activity is safer outdoors than indoors. And whether you're indoors or outdoors, you've got to do the things I just mentioned. Wear your masks and social distance and that sort of thing. And I'm happy that the Saints have been able to reach an agreement with the mayor, where they're going to be able to play at least the next few home games, I think it is. And whether they can increase the number of spectators will depend on what happens with the numbers in terms of cases and positivity and so forth in New Orleans. Obviously, I hope that they get to keep playing in the Dome, and that the number of spectators increases over time, because that means that New Orleans is doing better. But so I'm happy that they were able to reach an agreement. I do believe the Saints will be very professional and responsible in the way that they conduct their game day activities and seat their fans and get the fans in and out of the Superdome and so forth. And then they should have plenty of room to space out and safely watch the Saints win the football game.
There you go. Now, you mentioned the hurricanes that have hit our state, Laura and Delta in particular. And last month on September 16th, your birthday, we were talking about Laura. Now there's Delta. How is it looking in southwest Louisiana right now?
Well, my heart breaks. And I will tell you, the damage from Laura was just horrendous. The strongest hurricane since 1856, primarily wind damage, which was catastrophic for an awful lot of homeowners and business owners. A lot of debris left, and of course it did tremendous damage to the electrical infrastructure, the vast majority of which has been repaired. Almost all of our statewide outages right now are in Cameron Parish, and the system there was just decimated. It's taking longer to get that back up and running. But just when the lights came back on, people are starting to do their damage assessments. They're getting their temporary repairs made. Here came Delta, and Delta another blow, and we can talk more about that on the backside of the break.
But the governor, as we hit our first break, was talking about the devastation of Hurricane Delta, a late storm for Louisiana, but nonetheless a treacherous one that unfortunately hit many of the same parts of the state that got rammed a month earlier, 6 weeks earlier, by Hurricane Laura. How is the landscape right now in that area, Governor?
Well, look, everything is really tough. Laura was the strongest storm to make landfall in Louisiana since at least 1856. And then Delta came ashore 6 weeks later, 12 miles from the very point that Laura made landfall. And so it dealt a double blow to that area of southwest Louisiana. More rain damage in Delta than in Laura, and it was a bigger storm. So you actually had wind damage further out, but certainly the wind damage wasn't nearly as catastrophic as with Laura. And, I worry about, people's mental health, for example, because we had folks who were just getting their lights back on. Some people were in the process of getting their damage repaired, the roofs fixed, at least temporarily. And some people were in the process of coming back from shelters in New Orleans and in Texas, and that had to be put on hold. And some of the people who could have come back now can't because their home has sustained major damage, whereas it wasn't that way before. So we're working with all of that, and our federal partners have been really good. FEMA stepped up. The president did declare a major federal disaster declaration after Laura, and then again after Delta, which really helps. And we're trying to add parishes to that declaration as more damage reports come in, and we're justified in doing so. But it's a really, really tough situation. The good news is the people of Louisiana are good, generous, decent, hardworking, faithful people, and they know how to be good neighbors to one another. And we're seeing the faith-based community and the nonprofit sector just step up in tremendous ways to help people. So that is encouraging. But we're going to be a long time recovering from these hurricanes.
We start with Michael. I think I have the name right. Michael in Baton Rouge. Good morning or good afternoon, Michael. You're on with Governor John Bel Edwards.
Governor, how you doing? I know we've been through two storms, but my question is, I want to make a statement first. I'm trying to figure out, because I've talked to some guys that play in bands, including myself, and we're wondering why we can have 25,000 people in Tiger Stadium. You got Tigerland bars open, and they're not following the rules. I'd like to know who enforces the rules, because I've been to several bars lately in Baton Rouge and New Orleans, and I don't see 11 o'clock curfew coming into effect. So a lot of people not wearing masks and drinks being served at the counter. So I want to know, how can that take effect? Yeah, you can't allow a band to play outside. There's only 50 members. You allow 25,000 people to come to Tiger Stadium.
All right. Michael's fired up, Governor. Your response to
Yeah,
that?
and I had a hard time understanding some of what Michael was saying. I know that it sounded to me like he's saying some people aren't following the rules, and I guess that's always going to be the case. But we are trying very hard to have a safe way to reopen bars, for example. So we've tied it to the degree of community spread. And if a parish has less than 5% positivity over 2 weeks on their testing, they can opt in. And when they do opt in, the bars can open. Alcohol has to stop being served at 11. There's no minors allowed in, and patrons are supposed to be seated, and so forth. And we think that that's a reasonably safe way to do it. And I have no doubt that of all the bars we have, some of them probably aren't following the rules as well as we would like. But I don't, I wish we could get more compliance with that. With respect to Tiger Stadium, 25% occupancy allows individuals to go in and out of the stadium in a way that is safe. You have fewer people congesting those gates and so forth. And then when you get there, you can sit and spread out, and it's an outdoor venue and so forth. So that's a reasonably safe way to watch a football game, and we did that based on the totality of all of the plans that were made by LSU and other higher ed institutions around game day activities. It's not just the limit, but what we know is that one of the activities that absolutely causes the transmission of the virus is when people are too close together for too long, not masking, not social distancing, and we know that it's tied not just in the country but around the world to live music when there's dancing, and I think that may have been what Michael was getting at. Yeah. And so it's just one of those activities. Unfortunately, we're trying to do what we reasonably can, responsibly can, to minimize transmission of the disease, so that we don't have more people in the hospital and more people dying, but leave as much of the economy open as we can. And wherever I draw that line, there are always people on both sides of it who think I've either gone too far or not far enough. And I understand that, and it bothers me anytime I have to make a decision that affects people's livelihood or just seems to affect people negatively in any way. But at the same time, we're embracing those restrictions and mitigation measures that are being recommended to us by public health experts, including those coming out of the White House.
877-217-5757 for Governor John Bell Edwards. Ellen in Lafayette. Ellen, good afternoon. You're on with the governor.
Hey, how are you? Thanks for taking my call, Governor Edwards. I wanted to, first of all, I guess real quickly say that I think you've done a great job handling our COVID crisis in the state. I really have supported everything that you've done. My concern today, I'm really thinking about colleges, our state colleges and universities as it relates to COVID. My daughter is a college student, and the university itself has done a really good job. But I'm concerned about college students attending all online classes and the impact that it's going to have. It's multifaceted. It'll have an effect on their college education, and I think it's very much affecting college students' mental health.
All right, Governor, would you respond to Ellen?
Yeah, well, Ellen, first of all, thank you for calling in. And I, too, am the parent of a college student. My son is a freshman at LSU, and so I'm well aware of what you're talking about. And the one thing I can tell you about higher education is we've had multiple meetings with all of our higher education leaders, our chancellors, our university presidents, but our system presidents. Dr. Birx, the White House Coronavirus Task Force, has been part of those meetings on a couple of occasions. and they're doing their very best. I was talking before about striking the right balance between having as much of the economy open as you can and protecting public health. The universities are doing something similar. They're trying to deliver education as best as they can to their students and have as much normalcy on their campus as possible, but while also striking the right balance with the imperative to protect public health. And in order to space out in a classroom, you can't have the classroom full of students. And so one of the purposes of online education, at least in my son's case, is that if he has a class that meets Tuesday, Thursday, then he may meet only one of those days in person, and then on the next class he will participate online. So he's getting some in-class and in-person instruction, some online, but if they don't do it that way, they can't space out. And it's really important that we have that physical distancing in order to reduce the transmission. And we're learning from one another in Louisiana, but we're also learning from what's happening in other states. And I can tell you contact tracing is a big part of this. Testing is a big part of this. We actually are doing wastewater testing to try to see if there's certain dorms where the virus is more prevalent than others. And look, this is all very tough. And I will tell you, I'm thankful that they're participating with LDH in terms of reporting the number of cases and so forth, and I know they're trying to strike the right balance, and we're learning. And if you've got any specific ideas or concerns, we'd like to hear them. But I'm a parent of a son at LSU, and I'm familiar with what you're talking about. I too believe in-person instruction is superior to online instruction, and I want to get back to doing that just as soon as we can. But while we protect health the way that we need to as well.
I'm from Dardenne, and I just wanted to thank Governor Edwards for expanding Medicaid. He probably saved my life. I was just diagnosed with breast cancer, and I'm being treated for it. And if we didn't have him, no telling what would have happened to me. And he's doing a wonderful job, and he's going with the science, and I appreciate everything he does. And
all right. Thank you, Michelle. Governor, I suspect you are happy to hear from Michelle.
Well, I am, and I'm happy to hear that she's doing well. And this is October, so it's Breast Cancer Awareness Month. I will tell you, we have about 550,000 working poor Louisianans who are on Medicaid expansion right now. And they do have access to primary care, preventative care that they didn't have before. And what that allows for is the diagnosis earlier of diseases where they can begin treatment earlier and the outcomes are better. They have access to prescription drugs. And so there's no doubt that people are alive today who wouldn't be otherwise. Of those 550,000, right at 90,000 have been screened or undergone diagnostic breast imaging to look for cancer, and we know that well over 1,000 actually have been diagnosed with breast cancer, which is an awful condition. But at least they got that diagnosis and they got it sooner than they otherwise would. So I want to thank Michelle. It was the easiest big decision that I'll ever make, and I will tell you that it's paying dividends for our state. And look, we still got a ways to go because we're not as healthy as we want to be. But when you have more than your fair share of poor people, uninsured people, and poor health outcomes for generations, and you have an opportunity for 10 cents on the dollar to expand health care coverage to the working poor who've been without it for generations, it's just the right thing to do. And so I'm glad that it's working for her and for so many others.
What would happen if the Supreme Court were to strike down affordable care? Would that be devastating to Louisiana?
Yeah, if they struck it all down, it certainly would. And the reason is, and a lot of people don't understand this, I don't think our Attorney General understood it, that the Medicaid expansion is a component of the Affordable Care Act. So if it struck down in its entirety overnight, 550,000 people in Louisiana lose health insurance. And then those individuals either go without treatment or they go back to going to our safety net hospitals, which costs us a lot more, and it's not as good for them and ultimately you end up dispensing treatment in the emergency room, which is the most costly and least effective way to manage disease. But if they sever out a certain provision, they could protect the Medicaid expansion and get rid of the individual mandate.
The 55th time the governor has come before the people of our state in this realm, and this show is heard in a few other states around the country. And I know we have people literally listening from coast to coast online, and we thank you for your participation, and we'll get to as many of you as possible. Before we go back to the phone, starting with James in Longview, Texas, Governor, story today that is top news, a state Senate bill aimed at lessening a governor's ability to influence how our state holds elections during times of emergencies has advanced. And what are your thoughts about where this is and whether it's something you can stomach?
Yeah, well, I'll read the bill when it gets to my desk, and I haven't yet seen it. You know, they get amended all the way through. And I think your question had to do with the bill that deals with how we conduct elections during emergencies. Is that right?
Right.
Okay. Yeah. Well, what I can tell you is I would be very concerned because as I read the bill, because I know that the legislature gave approval to the Secretary of State for a plan for this current election that actually ignored the CDC recommendations for how to conduct any activity for the elections that we're going through right now. And so it's important to me that we have safeguards where people don't ever have to, risk their health or their lives in order to be able to cast a vote. Ultimately, because of litigation, we were able to have this particular election conducted under the same system as the previous elections in July and August, which, by the way, were successful. And so I think we ended up in a good place, and I'm just going to have to read the bill to make sure that it doesn't do something that would sort of default us into the situation that we were barely able to get out of, that I think would have been very detrimental to the people of Louisiana. Knowing that the bill was written by folks and supported by folks who also supported the Secretary of State's plan, I'll give it very close scrutiny, I can assure you. But I haven't done that yet, and so I don't want to guess as to what I'm ultimately going to do with the bill.
And then there's House Bill 4. It's at your desk. I don't know if you had a chance to peruse it, but the legislature last night gave narrow approval to the legislation, which would provide state lawmakers new ways to end parts of a governor's restrictions, in this case your restrictions, during the coronavirus pandemic. Is this something that is beyond the pale for you, or is it something that can be tweaked?
Well, so it can't be tweaked because it's already been passed, and I guess it could be at some future session of the legislature. So I haven't had an opportunity to sit down with the bill's author. I'm going to do that, and nor have I had an opportunity to address that bill with the Speaker or the President. I'm going to do that, too, before I announce what I'm going to do. But I will say what I said at the outset. The Constitution charges me with the authority and therefore the obligation to manage public health emergencies. We're in a public health emergency in Louisiana. The country is in one. In fact, the federal government, working through Secretary Azar, extended just recently the public health emergency for the country. And you have to have all the tools necessary at your disposal to properly and effectively manage that and make sure that you don't outstrip your ability to provide care in your hospitals, that more people don't die than is necessary, and that you can follow the science and the best recommendations of doctors and in this case, the White House Coronavirus Task Force. I'm not going to surrender any authority that I have to other people whose approach is entirely unreasonable. There are folks here who either believe that it's a hoax or they want to minimize it. They think we should have everything open without restriction and no mitigation measures in place. That's just not a reasonable conversation to have, and I'm not looking for an opportunity to invite those people into being part of the decision-making process. I will continue to make my decisions based on science. and recommendations. I will share the data that I'm looking at with the legislature and everybody else, as I always have. And so I can tell you that if this bill takes tools out of the toolbox that I believe are essential to properly managing a public health emergency, it's not going to meet with my approval. But I'm not making that news yet because I haven't talked to those three individuals I told you about.
Okay. James in Longview, as advertised. James, you have the floor with the governor of Louisiana.
Well, thank you, Jim. Good afternoon. Good afternoon, Governor.
Thank you, James, for calling in again.
Yeah, good to hear you. Anyhow, I was in your fine state just a few weeks ago, and I really enjoyed it. Anyhow, I'll just get right to it. It'll be a generic but fairly easy question as opposed to others. I hear some great news that Louisiana is experiencing some marvelous records with early voting, and I did my early voting here in Texas, and I think it's a blessing to have it. And do you credit early voting for such a massive turnout thus far?
Yeah. Well, first of all, thank you. If you go back several election cycles, the percentage of the people who vote early is always increasing, so those numbers are increasing. It doesn't always increase the total number of voters who participate in a particular election because sometimes more people vote early and fewer people vote on election day. But I will tell you, when you have a public health emergency like we have, when you have the ability to vote over an extended period of time, potentially when crowds are going to be smaller or when it's just better for you, or in certain cases, for example, we're using the Smoothie King Arena in New Orleans where it's a very large venue and people can spread out. It's just a safer way to exercise your right to vote. And I think some people are taking advantage of that. And it appears, at least from the information I'm gathering from the news, that there's a lot of interest in this particular election cycle that typically happens when you have the president election on the ballot. And so, I think it's a good thing that people are voting. I just hope that overall participation is up and not just early voting. And we never know if that's going to be the case until we get to the end of Election Day. But I do encourage all Louisiana voters who are eligible to get out and vote. I also encourage you to study the issues and the candidates and so forth so that you don't just cast a vote, but you cast an informed vote.
Thomas in Lafayette. Thomas, you're on the air with Governor John Bel Edwards.
Hey, Governor Edwards. Just was calling in to thank you for all the work you've done during this pandemic. You really it's been very impressive how you've stood your ground, you've followed the science, and, I went and did my early voting earlier today, and it was pretty heartening to see everyone masked up and keeping their distance.
Well, thank you, Thomas. I'm sure the governor is pleased to have an endorsement from you in the great city of Lafayette, where Stephen is calling. Stephen in Lafayette, you have the floor with Governor Edwards. Hi, Stephen.
Hey, Mr. Governor. Just a quick question. Whenever this whole pandemic thing really started, I basically work in a construction field, and during this whole thing, it's basically been construction on a go pace. And there was protocols put in place through, various companies, of course, that, keep your distance as much as possible, wash your hands, sanitize your hands. But in especially fields such as like residential new construction, where you're doing production-style houses, 50, 60 houses in a subdivision at a time, it's kind of hard to keep that distance. And I'm just kind of curious, why was it that residential new construction was considered, critical in the middle of a pandemic?
All right, Governor.
Okay. First of all, thank you, Stephen. And Jim, I need you to help me a little bit. Did Stephen say why was
residential new construction? Yeah.
Why was it considered essential, or why wasn't it?
Why? I think he said, why was it considered essential during a pandemic?
Okay. Well, first of all, that's a great question, Stephen. We interact frequently with the Department of Homeland Security, and in particular, the Cyber Security and Infrastructure Security Agency, CISA. And from the beginning of the pandemic, they've been designated by the federal government to interact with states and list those businesses, those types of economic sectors that are essential. And they deemed a number of things essential, one of which is construction. And we didn't differentiate between commercial and residential or infrastructure. So whether you're working on coastal restoration or highways or bridges or whatever, we believed, and I believed, that construction was essential, that we needed to keep that part of our economy moving forward, and so forth. And so that's why we did that. Now, we still had guidance out there that people should have been conducting that safely with distancing, washing hands, and masking, and so forth.
The governor, of course, is a graduate of West Point, but he also is a graduate of Louisiana State University, the Law Center, and he is fan number one for the Fighting Tigers, who are off to a tough start. And there's some news today we'll talk to the governor about Sports Illustrated reporting LSU is losing 8 scholarships over 2 years. And Governor, before we get there, the president's job is open, president and chancellor, and there's some discussion about splitting those posts, as was the case before King Alexander became both president and chancellor. Your thoughts about the wisdom of doing that?
Yeah, well, first of all, it's a great question. And obviously, before you fill the position, you got to know what the position really is and looks like. So you got to make this decision as a preliminary matter. I happen to think it's a close call. I will tell you for a couple of reasons, and it's always been a close call, but I gave an opinion many months ago when I was asked by, and there was someone from the Advocate, maybe it was Mark Ballard, what I thought. And I said I thought the board should give serious consideration of splitting those jobs back into 2 and having a separate chancellor of the Baton Rouge A&M University and an assistant president. But I will tell you that enough time has elapsed, and Tom Galligan has been there, and I've been able to watch him perform in the role as the president and chancellor in a very difficult COVID environment, by the way. And it seems like he's been able to do both of those roles well. But secondly, it costs additional funding to split them back open, because to one degree or another, you have to recreate at least some of the, I don't want to call it bureaucracy, but the staffing that will be needed. And quite frankly, it's not a good time for that because of what's going on with COVID and its impacts on revenues and expenditures and so forth. So while I thought it was a close call all along, my opinion on it has actually changed over time. And I'm not directing the board to do one way or another, but I think probably for the reasons I just stated, that the 2 ought to continue to be merged into one person, and then just make sure you have executive vice presidents who are over certain things that allow the president to tend to all the things that he has to tend to personally.
Now, your Commissioner of Administration, Jay Dardenne, has openly stated that he would like the post. Does he have your blessing?
Well, first of all, he's not told me that he's going to apply for the position, and I in fact, I don't think he will, based on the most recent conversation that I had with him. So I don't want to give currency to anything like that, Jim, and I appreciate the question, but I just don't think that's going to happen.
Okay.
And by the way, he is very qualified and would do a good job. I don't want to leave that out.
Okay. All right. Well, I mentioned the story that a few people have inquired about, and it's new news, but Sports Illustrated saying LSU has been spanked by the NCAA for infractions involving football. The most serious allegation related to booster John Paul Funes, former CEO of Our Lady of the Lake Hospital Foundation, and he was accused of providing funds to families of current and former student athletes and arranging for members of the institution's football staff to use a private plane and offering internships to football student athletes. Now, I doubt very seriously you've had a chance to sift through these allegations, but obviously, for those of us in Louisiana, the football program at LSU is a major force of life, and anything that happens to it affects us personally. Your thoughts about where we are with Coach O and having to deal with something like this at this time?
And not only that, I can tell you, Louisiana is a much easier state to govern when LSU's winning, Saints are winning. And look, the news that I thought you were going to talk about deals with Odell Beckham Jr., and this is self-imposed by LSU in hopes that it would satisfy the NCAA. But I think you may remember after the college football national championship game last year, there were some stories about Mr. Beckham and so forth. But LSU agreed to reduce scholarships by 8 and reduce recruiting visits, and it appears that Mr. Beckham would not be at the facility for at least 2 years. And so that's what I thought you were going to talk about. And so I had heard about that just before I walked into the room to start this radio program. I haven't heard at all about the incident, the issues that you were talking about. But obviously, we want to be champions. We want to have student athletes. We want people to graduate. We want them to be good citizens. And certainly we want a winning, not just football program, but all of our teams at LSU to win. And nothing like this is helpful. It really isn't. And so hopefully, and I have all the confidence in the world, by the way, in the board, in the president, and the athletic director to get all of this sorted out and get our program in the shape that it needs to be in, because these things, they're embarrassing. But more than that, I mean, it's just not who we want to be in Louisiana.
Jean in Mandeville, you're on with the governor. Hi, Jean.
Hi. This chronic voter wants to know why there was a mask mandate issued but no enforcement mechanism.
All right. I guess when she early voted, how do you force people to do something like this?
Well, I don't know that you can force people. You ask people to look at the recommendations that are based on data and science. We do have a mask mandate that is in place. I know that a conscious decision was made, and not one that I necessarily disagree with, that if someone shows up to vote and they don't have a mask on, they'll be offered one. But if they insist on voting without one, they're not going to be turned away. In that situation, I do hope that there's really good physical distancing and the other people around them have masks on, and that any interaction with those unmasked individuals be as brief as possible. And I'm encouraging everybody to wear masks. And by the way, it's really not controversial in the scientific community. They work to reduce the transmission, and they work because if you have that cloth covering over your face, then when you breathe, when you speak, and so forth, you're not emitting those particles containing the virus, like you would otherwise. And so when you wear a mask, you are protecting your neighbor from yourself. There may be some slight benefit to you as well, but really you're wearing it to protect your neighbor from yourself. And one of the reasons they're so essential is 40 to 50% of people with COVID don't know they have it. They're asymptomatic. So if you wait until you're sick to put a mask on, for most, or at least half the people, they've waited too long. And it's not asking too much, quite frankly, for people to wear a mask when they're going to be around folks who are not part of their immediate household. And I know that this is controversial with a lot of people. For the life of me, I don't understand why. I certainly don't know why there's a partisan edge to it. I just encourage people to do what the White House Task Force is recommending, and they have been 100% consistent in that recommendation ever since the CDC changed their guidance, I think, back in April.
Chris in New Orleans. Chris, you're on the air with the governor. Hi, Chris.
Hello. It's great to be able to talk to you, Governor. I want to thank you for your service to the country and your service to Louisiana. And I wanted to ask you, what can you do to help stop this catastrophe that's going on in the hospitality service industry in Louisiana? The country comes to Louisiana for tourism because we have great bars, restaurants, musicians, and all those folks are going out of business, can't work, etc.
Well, Chris, first of all, thank you very much for the call, and I appreciate the nice comments that you made. Look, the issue around tourism and the hospitality industry is extremely difficult because, quite frankly, as you know, and I think you alluded to, especially in the New Orleans area, we have an awful lot of restaurants and bars and other venues that cater specifically to tourists. And there just aren't enough people in Louisiana who live here to support all of that adequately. Now, what we have to do is we have to get past this virus to the point where there is consumer confidence, so that people will buy those airline tickets, so that conventions will return, and quite frankly, 80% of consumer behavior related to the virus is not dictated by restrictions imposed by government. It's dictated by whether individuals feel safe. You know, for example, 1 year after LSU won the national championship, and I can't remember exactly what the figure is, but it's less than 20% of the season ticket holders actually exercised their option to get tickets, not because they lost interest in LSU football, not because they ceased being fans, but because they weren't sure that it's safe. That's happening all across our state, all across the country, and all across the world. And so what we can do is offer assistance through the PPP program, through the Main Street program we have in Louisiana. We've allowed all the bars that can and want to transition to a restaurant to do that. We've opened bars in those parishes that achieve a 5% or less positivity rate for 2 weeks, and they choose to opt in. We've always left them open for 2 of their 3 video poker machines if they have them.
All right, Governor, I'm sorry, but we do have to part. Our time is up, but thank you so much for show number 55. We'll be back next month. Thank you, Governor.
Thank you so much. Appreciate you, Jim.